Doctor, very good evening. Thank you so much for being with us here on ENCA. Will that have any effect at all on the numbers we're looking at right now that travel back and forth?
Look, what we are seeing at the moment is kind of decreases in the 7-day moving average, and the Omicron variant has been detected in all of the provinces for a couple of weeks now. So I don't think that the travel back should have too much of an impact in terms of the number of cases. I think Gauteng, we'd seen that peak quite early on in December. The cases came down even before, people started moving outside of Gauteng. I think the coastal provinces have followed a little bit behind. And obviously we have to take, the Christmas period into account with slightly lower testing numbers. But I think we wouldn't expect, big increases in terms of the number of cases as people journey backwards towards their homes.
Just on those slightly lower testing numbers that you mentioned, do we worry about the testing numbers, or do we worry about the numbers that are testing positive, the positivity rate the most?
Yeah, so I think the positivity rate is probably a better metric to have a look at. I think we know that over the holiday periods there are slightly lower testing numbers, but I think the positivity rates have been steadily decreasing in all of the provinces, and so I think that's quite a good indicator that we are seeing that we're on the downward slope of this fourth wave. I think in terms of the testing numbers, if it was just that people weren't accessing testing, we would still expect the positivity rates to be very high. And a few weeks ago, I think they were kind of, in the high 30s, and definitely are coming down at the moment. So I think that's a very positive sign.
Okay, it's a positive sign. What about hospitalization data? What is that telling us?
Yeah, so the hospitalizations are actually continuing to decrease. I think in most of the provinces this has peaked, and so we're seeing this decrease in hospitalizations. And I think this really has been much lower in most of the provinces compared to previous waves, and definitely just the severity in terms of the amount of oxygen that's needed, the amount of, the number of patients that are requiring ventilation. So overall, the severity, even amongst those hospitalized, is a lot lower than what we've seen in other waves.
We're getting so used.
Very positive noise.
Very positive. All right, Doc. I mean, we're almost getting so used to these numbers getting churned out every day, and we're looking at today's numbers. Over 100 people have sadly passed away due to the coronavirus, or some complication from the coronavirus. Let's go back to 100 people. For me, is a lot of people passing away from anything on any given day. When we look at the second wave, is that what we're comparing these numbers to say maybe it's not as bad as it could be?
Yeah, so definitely. I mean, even from any of the previous waves, I think we're definitely seeing much lower numbers, especially of deaths. I think hospitalizations from Gauteng, where I think Gauteng's really, at the tail end of its fourth wave, hospitalizations were around 50% of what we'd seen with the third wave, which was driven by Delta. And hospitalizations were and deaths were about 13% of what we'd seen for Delta. So I think that's definitely what we're comparing to, and definitely any death is obviously something to be concerned about. But I think, this lower level of deaths compared to what we've seen previously, I think is really encouraging. And I think we can get those deaths even lower if we can just, get more people to vaccinate. I think the boosters are, the booster vaccinations are now available, and especially for those who just got the one dose of Johnson & Johnson. I think definitely to get their second dose of Johnson & Johnson as soon as possible. And obviously those with Pfizer, when they're eligible to have their booster dose as well. And for those who haven't vaccinated, because we know that vaccination and prior infection are going to really protect against the severe disease outcomes like hospitalization and death.
I mean, you make an interesting statement there, prior infection. Some people will say, listen, I've been infected already with this thing, so, my immune system is ready and waiting to fight it off to a certain extent, and they should still go and get vaccinated. That's correct.
Yeah. So I think prior infection does protect. I mean, we know that you get, natural immunity, which is strong. But I think that will wane with time. That has been shown in several studies that protection will wane. And I think you're getting a broader immunity by vaccinating as well. Because I think most of the vaccines, or the vaccines that we've got in use at the moment, are are based on the original strain. And so you're getting a much broader protection by being infected and then being vaccinated as well. So definitely, we would encourage those who've been previously infected to vaccinate.
So all indications are that the Omicron variant is a lot milder than we've seen before in the past. You think maybe people are staying away from vaccination sites because of that information coming out at the present moment? Because I think yesterday was just 52,000 people vaccinating throughout the country, and that is alarmingly low.
Yeah, look, I think it is also just the holiday period. I think there probably some of the healthcare workers have also, been taking leave, and we would hope that, as 9 January, that we'd be able to go full steam ahead with the vaccination program. And I think just in terms of, it being a milder disease, I think we're not yet sure whether it's milder because, of something different around Omicron, or whether it's milder because there just are more people, that are vaccinated during this wave, and more people that have obviously had prior infection compared to when we were in the third wave, where, very few, only our healthcare workers were vaccinated. So I think although it seems milder, I think it's unclear, what exactly is driving that. And it may well be just that we've got more underlying protection.
Doc, thank you so much for pointing out finding a silver lining in all of this data that we are given every single day. That's Dr. Michelle Groome, Head of Division of Public Health Surveillance and Response at the NICD.